Our action now is everybody have a responsibility, and this is unprecedented for the government to implement MCO. That means a movement control order. This is the first time we are doing it, and the period of 1 week is rather short for us to access. But more important is that we intend to break the chain of transmission of the virus. If everyone stay at home, that's a message that we want. Stay at home. For every individual, stay at home. Wash your hand, distancing yourself. That you will help Ministry of Health to break the transmission of the infection. And that's the reason why we have this MCO in place. More importantly is that we also need to protect the elderly at home. And if we are confined to our house, the infection will be less. That's the idea of the whole exercise. In the meantime, the Ministry of Health will enhance our public health activities. For example, active case detection, meaning that we will find the cases. We find the cases, we test the case and confirm, and then we isolate them, and then we treat them. So we will continue to do our best to look into the focus group. For example, now we know that 60% of the infection is among the tabligh group. Then we will go after the tabligh group to treat, to isolate, to detect them, and then to test them to make sure they are not carrying infection or infecting others. So that is how we're going to take our active participation in terms of contact tracing. In the meantime, we also take initiative to clean our environment, for example, whatever needs to be done, and then to act accordingly, to take all the precautionary measures, public health measures, and to maintain a good personal hygiene for all.
How long will Malaysians need?
Now we start off with a cycle of incubation period of 2 weeks. So we will review maybe at the end of the week or even end of before the 2 weeks whether they respond. So now we can see the trend. What we do today is we are trying to prevent in the increase of cases, for example, in the next couple of weeks. So what we have today, it was the result of what we have done in the last 2 or 3 weeks ago. Now the clusters that first wave is very easy because basically it's related to warga negara China, right? Second wave, we have a few clusters. So far, the main cluster is the one related to case 26 that infected 114 patients, for example. And what's more important, there are small clusters, but we are looking at the clusters. Maybe, perhaps they are first generation, second generation, and third generation related to the Jemaah Tabligh. So this is why index case been identified. Index case we have 986 Jemaah Tabligh been identified positive for COVID-19. Then this is the index case. They could have infected the first generation, the family members, for example. Second generation, the family members infecting their friends, for example, neighbors. And third generation, the neighbors infecting another person. So we really have the chain of infection, first generation, second generation, and even fourth generation be detected. So can you imagine for 986 index case? So looking into the network of the change of infection among themselves to first generation, second generation, and third generation.
Have you detected any disease that becomes sporadic infection?
The first sporadic case that we detected was in Bentong and then referred to Kuantan. And when we thought that it was a sporadic case because we are doing surveillance in terms of SARI, severe acute respiratory infection, as well as those of you who have influenza-like illness, for example, you come to our clinic, we will actually measure whether and test whether you have COVID-19. So our first sporadic cases we detected in ICU, that is actually a SARI patient, severe acute respiratory infection in Kuantan. But when we trace back the history, there was a history linked to the attendance in Jemaah Tabligh in Sri Petaling. What we are doing now is to increase the capacity of our lab. So our lab, we started with testing, the total testing test per day is about 3,500. Now we have increased the capacity to about 7,000 a day. So we have actually increased the capacity further to test, perhaps by end of this month, we should be able to test 16,000 cases. Now, if we look into, once we have this capacity to test, and we are also testing a few antigen, rapid test kit antigen. So we want to use the test. That means if we can test more people, asymptomatic, and if it's positive, then we will isolate them, and then we will treat them. So once we have a lockdown ataupun MCO in place, then we continue to look into the target group. So we will have a target approach. For example, certain group that we think there's high risk, then we will target them. And if we can pick them up early, that will be much better. And then we will isolate them and we'll treat them. So that is our, our plan in terms of to use this test. Now, if we learn from the Korean experience, they do about 20,000 tests per day. So we are not that far. We are doing about 16,500 in next one or 2 weeks time. So we will continue to test more people, and hopefully we'll be able to detect more. And by detecting more and taking the infected patient out of the society or the community, then we may flatten the curve. Flatten the curve means that our capacity of a hospital, we are really enhancing our hospital and able to treat the patient well. So you can see today that we have 64 patients managed in the ICU. And out of the 64 patients, we have 27 patients, if I'm not mistaken, 27 patients already on a ventilator. And if we treat them well, and then they can actually recover in time. The only worry is that when there's a surge, exponential spike, and the capacity is limited, then we have to choose which patient will have the privilege of ventilation. So we hope that we do not come to that stage to decide which patient can have ventilation and which patient cannot have ventilation.